Hello, and thank you for watching this smoking cessation webinar for the Bolder Healthier Community Champions. My name's Rachel Emmerich, and I'm the Public Health Officer supporting smoking cessation, which includes the Community Stop Smoking Service. So the aim of this session is to outline smoking cessation, including why smoking is harmful, elaborate on the benefits of quitting, and explore what support is available to Birmingham residents. So what is tobacco and smoking? So tobacco is made from the leaves of tobacco plants. It contains nicotine, which is an addictive substance. Smoking is the action of inhaling and exhaling tobacco smoke via cigarettes, cigars, pipes, etc. When you smoke tobacco in cigarettes, cigars, or pipes, you absorb toxic and cancer-causing chemicals that affect your health. Chewing tobacco or spit tobacco can be chewed, inhaled, or consumed orally. These products have particular cultural significance in some South Asian and African communities. Tobacco use is one of the most significant causes of health inequalities, and there's a strong link between cigarette smoking and socioeconomic groups. Smoking has been identified as the single biggest cause of inequality in death rates between rich and poor in the UK. Smoking accounts for over half of the differences in risk of premature death between social classes. So smoking is one of the biggest causes of death and illnesses in the UK. Every year, approximately 76,000 people die from smoking in the UK, with many more living with debilitating smoking-related illnesses. Smoking increases your risk of developing more than 50 serious health conditions. Some may be fatal and others can be irreversible long-term damage to your health. You can become ill if you smoke yourself or if people around you smoke. Secondhand smoke or passive smoking. So tobacco smoke also contains 4,000 chemicals, many of which are known causes of cancer. When you smoke, all of these chemicals mix together and form a sticky tar. The tar sticks to clothing, skin, and to the cilia, which are tiny hairs that line the inside of your lungs. The cilia help to clean out dirt and germs from your lungs. If the cilia are covered in the tar, they can't do their job properly, and germs, chemicals, and dirt can stay in your lungs and cause diseases. Acetone, which is nail polish remover, and ammonia, which is a household cleaning agent, as well as sewer gas, methane, and barbecue lighter, hexamine, they're all found in cigarettes, and they also contain arsenic, which is used to be used in rat poisoning. And the list goes on and on. I think that image shows quite a few. So it's been estimated that domestic exposure to secondhand smoke in the UK causes around 2,700 deaths in people aged between 20 and 63 years, and a further 8,000 deaths a year among people aged 65 and older. A child who's exposed to passive smoke is at increased risk of developing chest infections, meningitis, a persistent cough, and if they have asthma, their symptoms will get worse. There are also long-term effects that can be cyclical in nature, such as a child who lives with a smoker is twice as likely to become a smoker themselves. Pets also sometimes swallow cigarettes and other tobacco products, causing nicotine poisoning, which can be fatal. So every year, 76,000 people in the UK die from smoking, with many more living with debilitating illnesses. Some may be fatal and cause irreversible long-term damage. It's never too late to quit smoking, and with the right support, you're 3 times more likely to quit for good. So smokeless tobacco is associated with many health problems. Using smokeless tobacco can lead to nicotine addiction. It's been linked with oral cancers, so cancer of the mouth, the esophagus, as well as pancreas, and it's associated with diseases of the mouth. It can increase the risk of early delivery and stillbirth when used during pregnancy, and it can also cause nicotine poisoning in children, and it may increase the risk for death from heart disease and stroke. So what are the benefits of quitting smoking? So it increases lifespan. Ash have reported that 2 major longitudinal studies have demonstrated the benefits of stopping smoking at an early age. The 50-year follow-up of a study of British doctors revealed that if smokers quit before the age of 30, they can avoid more than 90% of smoking attributable risk of lung cancer. A similar study of British women also found that stopping smoking before the age of 40 avoids more than 90% of increased risk of dying caused by continuing to smoke, while stopping before the age of 30 avoids over 97% of the increased risk. Stopping smoking increases life expectancy, and stopping smoking improves health status. So there's the reduced risk of heart disease, stroke, vascular disease, respiratory disease, and certain cancers. There'll also be an improvement of symptoms of COPD and have a knock-on effect on physical and mental well-being. You also save money. Smoking's expensive, and the prices continue to rise. If you're smoking 20 cigarettes a day, you're likely to be spending around £3,500 a year, based on the average cost of £9.60 for a pack of 20 cigarettes. By quitting, you save money to spend elsewhere. There are various cost calculators online. I think the NHS has one, and you can work out how much you can save by quitting smoking. To also prevent harm to others, so the reduction in passive smoking, secondhand smoking, protects your friends, your family, and the wider public. And it reduces the chance of young people picking up smoking. And then in terms of smoking in pregnancy and the reduction of smoking in pregnancy, stopping smoking will reduce the risk of harm during pregnancy. Every cigarette smoked contains over 4,000 chemicals, and when pregnant, can restrict the essential oxygen supply to the baby. As a result, their heart must beat harder every time you smoke. Smoking during pregnancy increases the risk of complications such as miscarriage, premature birth, low birth weight, and stillbirth. So the wider benefits of quitting: over 1.5 million people in England require social care support because of smoking. Every year, local authorities in England spend 1.2 billion on home and residential social care support caused by smoking. So that's the equivalent of to 8% of all local authority spending on home and residential social care support for adults in England. Smoking is estimated to cost the NHS 2.5 billion every year, the equivalent to 2% of the health service budget. So then this slide here shows ASH and NCSCT. So you can refer to them for the national guidelines around smoking. They have a lot of resources on there as well, free resources that you can download. That kind of not just reports, but also kind of the public health campaigns. Obviously, now we're in October, so Stoptober is the big campaign, and there's just lots of resources on there in terms of leaflets, videos, case studies based on people's personal experience of smoking and stopping smoking. Yes, really recommend that you take a look at ASH and the NCSCT as well. So smoking in Birmingham, so the prevalence among adults in Birmingham was 13.6% in 2021 to 2022. So there's never been a better time to quit to protect you and your loved ones and reduce the pressures on the NHS. Smoking attributable death accounts for around half of all deaths across Birmingham every year. And again, we've already covered, it just increases the risk of lung infections, illness. Smokers are twice as likely to get pneumonia and 5 times more likely to get flu than non-smokers. It's really important as we're entering the colder seasons. So quitting smoking rapidly reduces your risk of other health problems such as heart problems, stroke, and cancer. And again, I guess it's just repeating the key message that it's never too late to quit. With the right support, you're 3 times more likely to quit for good. So sorry. Yeah. So the plans for Birmingham then. So sorry. So there's the 10-year plan A bolder, healthier future for the people of Birmingham and Solihull. It sets out a 5 to 10 year commitment that all health and social care professionals will complete basic e-learning for behaviour change, and those in clinical contact roles completing additional training on very brief advice for smoking cessation. The strategy also sets out the vision for future and the improvements that we want to see over the next 10 years for everyone who lives, works and receives care in Birmingham and Solihull. Okay, so then this tool is actually taken from Ash, one of the sites shown previously, and it kind of just details the kind of the position that we're at in Birmingham in terms of like the estimated costs. Sorry, and the additional kind of pressure in terms of costings for healthcare, social care. It's a really interesting tool, actually. If you type in Ash Ready Reckoner, you can actually filter on different areas in the UK and actually compare the different positions in terms of the smoking cessation. And it's quite good in terms of comparisons. It's quite a good visual as well, just to kind of share and actually just show the full impact that smoking has, specifically on Birmingham. Okay, so then, smoking in the workplace. So smoking negatively affects earnings and employment prospects. The cumulative impact of these effects amounts to productivity loss of 296.4 million. In 2019, 23% of adults in routine and manual occupations smoked, compared with 9.3% in managerial and professional occupations. Um, so as we know, in terms of legally and law, smoking is not allowed in enclosed workplace, public buildings, or on public transport. Businesses must display no smoking signs in all workplaces and vehicles, and staff smoking rooms aren't allowed. Smokers must go outside. Then on to smoking-related inequalities. In 2019, the government pledged to make England smoke-free, and since then, there's been significant progress in reducing smoking across the West Midlands. 40% of Birmingham and 12% of Solihull residents live in the most deprived communities in Britain, and that 1 in 3 in Birmingham are living in poverty. So then the barriers people face when trying to quit smoking. So we've got nicotine withdrawal, cravings and triggers. I think specifically what's often mentioned is kind of social events, birthdays, weddings, where it's, I guess it's the environment, the situation, and then handling stress as well. I guess in personal life, areas of high stress, it could form one of the triggers to start smoking once you've attempted to quit. So I think that's why, in terms of the services we offer, behavioural support to help managing mood, and then having the open discussions about slips and relapses. And another thing as well, I think that sometimes can be mentioned is the weight gain and appetite. And I think it's almost seeing the positive in terms of the appetite returning, and then in terms of weight gain, because of the service we offer, it's with frontline GPs and pharmacies, where weight gain can always be addressed if that's something of concern. So overcoming these barriers, so um, part of our service is the NRT, the nicotine replacement therapy, alongside behavioural support. So nicotine withdrawal can cause nicotine cravings, increased appetite, depression, restlessness, poor concentration, irritability, disturbed sleep, and lightheadedness. There's strong evidence that using a combination of nicotine replacement therapy, so NRT, such as patches, gum, lozenges, is more effective using them, using a combination than just quitting cold turkey. So in terms of managing your mood, so it's common when quitting smoking um, uplift your mood by staying active, structure your day, keep busy, get the support that you need from GPs and pharmacies. And then in terms of slips and relapses, um, not successfully quitting isn't failure. It's part of the wider quitting journey. I think most people will have several attempts of trying to quit smoking, and it's about kind of readdressing what happened and then building yourself back up again to the quit attempt to then go on and hopefully quit successfully. So using NRT, having the behavioural support. The next slide. So this is just an image from cancer research, kind of just addressing, so what is the most successful way to stop smoking? Um, they did a study and it showed that 60% of people are more successful at quitting when using NRT, e-cigarettes, when compared to just going cold turkey. So the most important thing is to stop using tobacco. Offering e-cigarettes as part of a quit attempt can be really helpful. And that's part of our service as well. E-cigarettes are an option for those that have tried patches previously, or kind of have the hand-to-mouth action with cigarettes. So guidance from the NCSET recommends support for people using e-cigarettes as part of a quit attempt. The NCSET was on a few slides back, alongside the ASH logo. Yeah, so it's another platform to use for more information. So then we're on to the Birmingham and Solihull position statement on e-cigs and vapes. So e-cigarettes and vapes do form part of our stop smoking service. They are part of the offer. So the Tobacco Control Alliance. So this is just the position that has been stated on vapes. So don't smoke, don't vape, swap to stop. If you've never smoked, don't use e-cigarettes. So they support the provision of e-cigarettes and vapes as a short-term aid to quit smoking. Evidence shows you're twice as likely to quit smoking if you use a vape compared with other NRT. And e-cigarettes do not produce tar or carbon monoxide, two of the most harmful elements in tobacco smoke. So stopping smoking can benefit both physical and psychological health. The COMBI model, which is the behaviour change model, can help us understand individual behaviour. Smoking cessation can be influenced by what we know, what we can do, the people around us and our physical environment, our beliefs, what we want, how we see ourselves and how we regulate our emotions, our habits. That's the motivation. So on to what support is available in Birmingham. So Birmingham Public Health Commission primary care providers, that's our pharmacies, our GPs, to deliver the 12-week service, which consists of behavioural support and nicotine replacement therapy, as well as vapes. So we have a website where you can put in your postcode to find your nearest pharmacy or GP that offers the service. And then it's a case of contacting them to arrange your first appointment. So these services are available to anyone that lives, works, studies, or has a GP in Birmingham. And we also have our Quit with Bella app as well. So it's a app that has an artificial element, Bella. It's accessible 24/7. To download it, you have to be in the Birmingham location, so the parameters. And using the app, you can also get access to NRT. And it's kind of got that, it's got a chat function, a robo coach, and you can use the app alongside support from your pharmacy as well. Just for context, in terms of the behavioural support that you receive from your pharmacy, GP, the aim is at the initial appointment, you kind of go in, you discuss previous barriers to quit, your kind of your tobacco use history, and the aim is to set a quit date. And you set that initial quit date. Ideally, it's 4 weeks from your initial appointment, so it's your 4-week quit date. And then at that appointment, if you've quit successfully, then we kind of move the target to a 12-week quit date. Um, so that's why it's a 12-week service. So then back to Bolder Healthier Community Champions. So what you can do to help. Um, so your role as a Bolder Healthier Champion is to talk about the importance of support of quitting smoking, but also kind of the different offers that are available to Birmingham citizens, the pharmacies, the GPs, the Quit with Bella app. I think it's just making sure people are aware that the service and the support is there. It's there to be used by Birmingham residents, Birmingham citizens. So the support is on hand. Um, I think that's the thing. I think not everyone knows that the service is out there. And also in terms of the costing around it as well. So obviously it's a free service to access. In terms of the NRT and the vapes, for the 12-week period. If you pay for prescriptions, you pay the one-off uh, prescription fee. I think it's £9.85 at the moment, not sure. But you just pay that once, and that covers the full 12 weeks worth of NRT or vapes. If you don't pay for prescriptions, you don't pay for any of it. Um, and I think it's just really important in terms of the cost around it, because obviously patches and things, if you're trying it on your own, can be expensive, and by going to the pharmacy GP, you get that kind of additional behaviour support, the additional check-in. Um, so in terms of your role and what you can do, I think it's just sharing the important message. I think it can be difficult because you hear smoking is bad, you shouldn't be doing it. And I know we kind of covered that at the beginning in terms of the statistics, but I think it's just also important to remember in terms of the passive smoking, the secondhand smoking, the effect it can have on the people around you, your pets, um, and that the support is there, and how it can also help in terms of preparing for surgeries, helping you reach other kind of health goals. It could just have such a big impact on your overall health, which I think is not always thought about. So yeah, just sharing the message in terms of quitting smoking, why it's important, and then the support and the resources that are available. Um, and then also, I guess it also says in terms of feedback, feedback either from yourself or from talking to residents. We do collect feedback as part of the pharmacy GP service anyway, but in terms of what you think we can do more, how we can actually get the message out, that the service is there, it's there to be used. And then I think on the next slide we have maybe it's further along, we have a list of resources and advice, um, and the kind of the overall campaign messaging. Make every contact count, very brief advice. The NCSCT that was on one of the previous slides, they have a very brief advice module. I don't think it takes that long. I think it was 45 minutes when I did it, and it just kind of just goes through informally, just having those conversations with people in the community. In terms of make every contact count, this is something that we always say to our pharmacies and GPs. If someone's collecting a prescription, just kind of asking the question, or if someone's there for like a routine health check, oh, we have on our system you smoke. Are you still smoking? Have you thought about quitting? Just having those conversations. Um, so then um, talk to people in your community. Talking should always be done with the intention of helping connect people to the right supports, not taking on the responsibility or offering professional guidance. I think that's really important, especially with the Stop Smoking service. The inclination to wanting to quit has to kind of be there in terms of the motivation. The person can't just be there because one of their loved ones wants them to quit. They kind of have to have that initial want to quit themselves. Um, So always use approved information and try and remain neutral. Don't get personally involved with the people you're trying to help. So what do you talk about? So I guess it's spot people who may need your support, share messages, and encourage people within your communities um, to seek out help, have the conversation with GPs and pharmacies, find the ones that offer the service. And I guess also promote these webinars within your own network. Um, so then in terms of how can you provide brief support in everyday interactions, so we've got the ask, advise, act there, kind of having those conversations. Are you visiting your GP for advice? Do you have the support necessary to aid smoking cessation, so whether that's the NRT or the vapes? So then here we just have an example of how you can offer help. So we've got the two people there in terms of on a dog walk. Are you enjoying your walk? Yes, I really enjoy the fresh air, but I'm noticing a heavy chest when taking for a longer walk. Do you know of any services available to me to start looking to quit? Yes, I do. And then these slides will be shared with yourselves. There's the links there in terms of to find your nearest pharmacy GP provider, as well as the ASH link as well. And then I'll have a look when I'm home. Perhaps we could have more of a conversation. So then here we have the Directory of Public Health Resources, specifically for smoking. So then you're our eyes and ears into the community, and you can tell us where more help's needed and how best to provide it. Please do email us or connect through social media. Yeah, your feedback's really important. It does instigate change. And I think we'd also appreciate any feedback you have in terms of from people that have then gone on to access the service, or any feedback that kind of hindered the attempt almost. If there's no pharmacies, GPs in their area. Yeah, so any feedback really, please do email. So thank you for being a bolder, healthier champion. We hope you enjoy these sessions and enjoy promoting positive health and well-being to your community to improve their health and well-being. We want to thank you for being a volunteer to a bolder, healthier champion. Finally, thank you so much for watching this webinar. We couldn't do this without you. Thank you.